think we do not have an objective method of assessing early wear in total knees. And MR, the way we are doing now, it is a tool to identify early wear and osteolysis pattern in knees. These are my disclosures. Rotating platform knee was introduced in US in 2001 after extensive trial in Europe. The benefit is reduced wear, and the reduced wear is due to conformity and decoupling of the bearing surfaces. And this has been confirmed in the laboratory that the mobile bearing knee wear 3 times less compared to the fixed bearing knees. But there is no defined method, clinical or otherwise, to show the difference between the fixed and mobile bearing knees objectively. So my presentation is to address this issue. So compare the fixed and mobile bearing knee is what I'm going to present to you using MRI as a marker. And this will identify early wear-induced synovitis and or osteolysis. Traditionally, MRI, due to metal scatter, was not utilized to study this subject. But improvement in the MRI, which you heard from Anil, we are able to do it now. We can suppress the metal, and with the fast spin echo and a special software program, we can see these particle-induced synovitis and or osteolysis, as shown by the arrow. It shows synovitis and it also shows osteolysis between the metal and the bone interface. Amar and rest of us have presented and published a paper, and same patient, one knee fixed bearing, other knee mobile bearing knee. There were 26 such patients, and they were followed for, in this study, 16 months for rotating and 46 months for fixed bearing. And we assess the results using the standard methods. All patients were contacted, and it was a prospective study, and it was a IRB approved study. Now, from this patient, we identify those patients who want to have MRIs. 11 such patients agreed for it. And in these 11 patients, 8 actually had it, because 2 patients say they are fearful of getting into the MR table. So the follow-up now on these patients is 8 years for fixed bearing and 6.6 years for mobile bearing. Clinically, there were no significant difference from all the parameters which we have. MR particle-induced 3 fixed bearing knee demonstrated a significant intracapsular burden of particle disease, and we can measure this amount with the software we have, and the amount of the synovitis was 2,000 cubic millimeter. One rotating platform showed also a particle-induced synovitis, but the volume of that is around 250 cubic millimeter. And here is one such example, arrow indicating the synovitis, and the arrow indicating the synovitis, and in the next one I'll show you, you can see the osteolysis also. So 3 fixed bearing and 1 mobile bearing showed some osteolysis, and here is the example. Arrow shows the osteolytic area, and this is in a rotating platform in the patella osteolytic lesion. So this is the first study to support that in real life the mobile bearing knee have a less wear. It is a patient-controlled study, so I think it has a meaningful data. Whether these differences will manifest clinically, time will only tell. The limitation of it, the follow-up is not the same in the both group, and number is small. So in conclusion, rotating platform knees continues to demonstrate equally good results as compared to fixed bearing knee. Rotating platform knee demonstrated lower wear-induced synovitis, at least in this study. I thank you for your attention.